Hi everyone. So infants or infancy would be from birth to about age 3 is what this chapter would cover. And then early childhood would start at age 3. Sometimes when babies are born, it looks like they have very large heads. That is because the brain grows first and then the rest of the body follows suit. So when an infant is born, the brain is about 1/4 of the size of an adult brain. By the time that child reaches the age of 3, that brain is about 75% developed. So there's a lot of growth that happens during those first 3 years. And so as the brain starts to grow and develop, then the rest of the body will catch up. So the torso and the arms and the legs, hands, feet, all of that will begin to catch up with it after that. Sensory motor development starts in the womb. So that's going to start working before some of your other major body parts. So the height and weight of an infant, on average when babies are born, they're about 7.5 pounds, 7 pounds, 7 ounces, somewhere around there. 20.5 inches would be the length. So this chart kind of gives you a gradual progression so that you can see how much and how fast they're growing about every 3 months or so. So this takes you from birth to about 2 years of age. Because the skull is not fully formed when the baby is born, it's important to be very mindful of how much neck movement and how much their head is being impacted, potentially by any trauma. Shaken baby syndrome is something that happens typically when a parent loses their temper, they become angry, frustrated, sometimes colicky babies who cry nonstop can get on a parent's nerves and they lose their patience. More so than women, we see men that are responsible for this. However, there are women that are held accountable for this as well. But unfortunately, when it comes to, as you'll see in the video that you watch here, the damage that is done to the brain when a baby is shaken is irreversible and often leads to significant impairment or death. Babies can lose their eyesight, they can lose their hearing, they can experience brain bleeds, and in some cases death is a possibility from shaken baby syndrome. So there's a lot of other options. The video that you watch is kind of a public service announcement, so it walks through some things that you can do when you're stuck home with the baby and the baby won't stop crying. But never, never, never shake a baby because the damage, like I said, is just irreversible and life lasting if the child survives it. So here you can see different scans of a newborn versus 1 month, 9 months, 2 years, and an adult. Their brains are just growing so rapidly, those first few months of life. And then it will start to slow down once they hit about 3 months. But the neurons and the neurological connections are just multiplying, as the baby is taking in new information and learning about the world around them. A normal average infant will sleep about 16 to 17 hours per day. This can vary slightly less or slightly more, as you can see. It's extremely rare for babies to sleep less than 10 hours a day. Their sleep is kind of broken. That's usually due to them being hungry. So the quicker you can get them on a feeding schedule, the longer they'll start to go in between needing those feedings. And then obviously making sure that they're changed and clean and comfortable. Most of the sleep here at this stage is REM sleep. That's what helps to provide brain development. So they spend about half of their time in REM sleep as an infant. SIDS stands for Sudden Infant Death Syndrome. The items that are listed on this slide are associated with higher cases of SIDS. However, we still don't have a clear-cut answer as to why SIDS happens. We don't know why some babies don't survive, why some babies stop breathing in the middle of the night. It's not necessarily anything that the parents did wrong. However, we do see more cases of SIDS associated with low birth weight, exposure to cigarette smoke, soft bedding. Nowadays, you're supposed to keep the baby sleeping on their back, or they also have side wedge pillows. You're not supposed to put a baby on their stomach to sleep. That increases the chances of them struggling to breathe or stop breathing in the night. So these are all recommendations from the pediatricians and the experts that do the research in the field, but these are also always changing as well. So you have to, kind of keep up with the current research and figure out what's best for your baby and what you think works, when the time comes. Breastfeeding versus bottle feeding or formula feeding. The experts will always say breastfeeding is the better option. However, just because you give your baby formula doesn't mean that you're doing anything wrong. There are lots of reasons why formula is a better option than breastfeeding for some moms. Some babies just struggle to latch on. Sometimes the milk doesn't produce. Maybe mom has some health complications and she's on medication and she can't breastfeed because of that. There is something wrong with the palate or the lips or the throat of the baby, and breastfeeding is not the better option. So there's pros and cons to both, but just because you choose one over the other doesn't make you a bad parent or a worse parent or anything. You have to do what's right for you and your family as well as for your baby. When I think about young kids and malnutrition, I often think about those commercials that we see from kids in these underdeveloped countries that are starving to death and have these big bloated bellies because it's part of the starvation process. But we have problems here too in the United States with malnourishment and kids not having enough to eat and, babies not getting their nutritional value daily. We have programs that can help here as well as around the world that help to eliminate some of the malnutrition. But those first several years of life with all the growth and development that goes on, it is so essential that the babies and the young toddlers or early childhood get the appropriate amount of food that they need. Otherwise, we see sometimes delays in cognitive development. There could be like memory impairment, learning disabilities, sometimes even permanent brain damage those first couple of years. So it's estimated that there's about 195 million children under the age of 5 that are undernourished. So they're still getting food, but they're not getting the proper amount of food. And then we have programs like Feed My Starving Children that help to feed kids around the world. And so some of you have probably participated in this and packed meals. So that can be a great source of nourishment for children in those situations as well. And we have a program here in the U.S., WIC, stands for Women, Infant, and Children. I believe they're on it now till the child turns 6. But that can provide formula for infants. And then as the baby breaks away from infant, it's like eggs, milk, peanut butter, cereal. I think they allow some types of fruits and vegetables now. So some of your more healthy, nutritious type food that's going to help make sure that the child does not become malnourished. Early childhood amnesia is really just a fancy term of saying that that part of the brain has not developed, therefore the infant or child cannot store long-term memory. It's not the type of amnesia like there's damage or a car accident and somebody forgets. It's just that part of the brain that holds long-term memories doesn't develop until around the age of 3. And so your first memory, most likely, is not before age 3, 3.5, maybe even 4 years of age. It's not that, obviously every case is different. It's not that some are going to remember or not remember, but on average, this is what we see. But with kids under the age of 3, it just takes a little bit more time for that brain to fully develop. Teaching infants to sign can sometimes help alleviate the stress and the frustration that parent-child feels over trying to understand and communicate with the child. Language takes time. Kids don't really start talking in multiple word sentences until about the age of 3. By the time they're 15 months, they may have, 18 months, they may have about 15 words down. At a year, they might have 5 or 6 words down. So it's a gradual process that takes time. Teaching infants sign language can help, like I said, alleviate some of that stress and frustration so that the child can communicate with the parent. It doesn't take away from the baby's ability to speak or to learn language. There are some fears out there, but there is no research that supports, sign language is going to make speech happen any later or delay it in any way. We do have, due to the Jeannie case, I don't know if you guys have heard of Jeannie, the wild child type stories, but Jeannie is a young girl who was discovered living in her parents' home at the age of 13, and she was confined to a room which consisted of a potty chair that she would be strapped into during the day, as well as a cage, like a dog cage, that she would sleep in at night. So her growth was stunted. She was very malnourished. At age 13, she was about the size of a 7-year-old. We learned something very important with her case. Being that she was 13 when she was removed from the home, she missed what the theorists would consider to be the critical period of developing language. And although when she was first recovered from the home, she made progress and strides towards language, she never fully developed or understood it, found her own ways to communicate, but missed that critical window of speaking and learning language, and therefore was never able to pick it up. So when we look at language development, sign language can be a great alternative, but for most babies, their speech is going to pick up and it's going to develop, but that sign language can just be an extra help in the meantime. To circumcise or not, at this point in our developed nations such as the United States, or Western world as we like to call it, circumcision is really just a personal preference, cosmetic at this point. There's not really a medical reason to circumcise. Some say it keeps it cleaner, less chance of infection, but we should be able to do that whether or not the infant is circumcised. So there's still, some strong beliefs in circumcising. We don't see that so much over in Europe. Most boys are not circumcised. Sometimes it's like a passage of rite that happens. There is something that's called a female circumcision, which is highly painful, not done under safe circumstances, but there are many developing nations that still partake in it. Female circumcision is when they remove the clitoris, and they do this around the age of puberty because women are not supposed to enjoy sex. They are to have sex to reproduce, and that is the only reason. And so if they remove the clitoris, they remove the enjoyment, and it also means the woman is less likely to stray from the marriage. So why we do not, want to see this practice, and there's groups out there that are trying to stop things like this from happening. It still is a practice that goes on, but like I said, happens around the age of puberty. If we circumcise a boy, it's generally done before you leave the hospital, so the infant is 24 hours old, maybe 48 hours old, and not going to have any kind of memory of being circumcised. Here's some more thoughts and beliefs on different types of circumcisions around the world. I'll let you guys read through some of these and see what other countries have to say about it. There's some advantages and disadvantages to circumcision today. One of the things on here, less likely to contract cancer of the penis. If they are circumcised, however, cancer of the penis is quite rare. So does circumcision really play that much of a role in whether or not a child is likely to get cancer of the penis? So you can kind of weigh the pros and cons that are associated with circumcision, whether or not you should circumcise. These motor development milestones, these are all approximate ages. There are checkpoints that the doctors look for when you take the baby in for an office checkup or to receive shots or vaccinations. But babies do things when they're ready to do things. On average, we say babies walk at a year. Some walk as early as 8 months, some don't walk till they're 18 months, and that's okay too. So just because the baby doesn't do this at a set age doesn't necessarily mean that there is a problem. We just want to see them progressing in their motor development. Eleanor Gibson did this ecological view, and with this we look at the visual cliff experiment that was done. So babies are placed on a plexiglass and it looks like a visual cliff. So they're on like a checkerboard type pattern and it looks like the cliff drops off. The idea is, is the baby going to cross it? Are they fearful? Is it just inherent, whether they cross it or not? So there's a lot of work that's research that's gone into this. There's a YouTube video I want you to check out called Babies on the Brink, which is kind of an updated version of Eleanor Gibson's earlier study. So take a look at that and you can see we've come quite a long way in how we're able to measure this visual cliff experiment and whether or not babies have this fear or not. So this slide addresses infant perception. Something like the black and white simple shapes that you see, the square, the circle, the house, the apple, that's not going to hold a baby's attention for very long because the shapes are very simplified. As you can see in the bottom left, the infant's perception time, 0, 10 seconds, 20 seconds, 30, 40, and so forth, increases as you get more detail in the image itself. When we see children's toys or daycare centers set up, we often see toys that look like this or rugs. This is what's going to hold a child's attention. So the more pattern and design is going to help their perception and understand the objects better. Infant's sight is the last of the 5 senses to develop. When the baby's born, they see the image on the left. So you can see it's not very clear, rather blurry. By the time they're about a month old, their vision has changed. And so their sight has developed more and they can see things a little bit more clearly at this stage. So there's 5 infant reflexes. These are the first 3 of the 5. The grasping reflex, the startle reflex, also known as the moral reflex, and the rooting reflex. So babies learn to grasp at an early age. Even in the womb, you can see them holding a finger or a hand. So that grasping reflex is already present. Startle reflex, babies will jump or shake when they hear loud noises. The rooting reflex is when you touch the side of their mouth, they automatically turn. They're looking for food. So it's just an automatic reflex as they start to search for the nipple for something to eat. The stepping reflex you see in the left picture, if you hold babies up and put them in this position, they'll automatically move their legs up and down like they're walking, but obviously don't have the muscle tone or body structure to actually walk. And then you have the sucking reflex, which is completely normal and healthy for infants to have a sucking reflex and want to suck on the pacifier, the nipple, their fingers, whatever it is that they're looking for. When babies don't have the proper amount of reflexes, that indicates that there could be some type of neurological problem that the doctor would then look for. Then we have the 6 motor milestones. So like I mentioned in previous few slides ago, these are again approximations. So on average we see pictures A, B, and C happen in succession, but not all the time. And if something happens out of disorder, that doesn't necessarily indicate that there's a problem. But we would like to see babies making this type of progress around these months of age. So these would be motor milestones 4, 5, and 6 that you see here. Although some babies skip letter E altogether and don't even bother to enter the crawling phase. Other babies scooch on their bottoms across the floor, and that's their method of transportation until they learn to walk. Sometimes putting shoes on their feet can help sturdy them. That can offer them the support that they need to take those first steps. But again, babies are going to get there when they're ready to get there. Joint attention is the baby's ability to track behaviors from one side of the room to another, or if looking at a book from one page to the next. If you point to a picture on the left side of the page and then point to something on the right, the baby should be able to follow that lead and see the connection between the two. So they're able to offer some type of joint attention by noticing these different things that are going on from one part of the room to the next. You can see there's a couple different theorists on this page that have differing views. Andrew Malthoff just suggested that imitation, emotional, and facial expressions happen within the first few days of birth. That it's not imitation, but it's rather an automatic response. Kind of see this a little bit with like the whole reflexive versus social smiling. That'll come up in a few slides. Deferred imitation occurs after around 18 months of age is what Piaget suggests. But we know that some of this imitation happens sooner too. You know, babies start to imitate waving. Around the age of 7 or 8 months, the hand gestures start. And so when a baby waves, they often do open, closed fist, open, closed, and that they're imitating what they're seeing other people doing or trying to imitate to the best of their ability at that point. So I mentioned the wild child clips earlier. This is a video link to one of those situations where a child was not grown up or nurtured in the right environment, and therefore language was delayed and learned how to make sounds or things with the animals or people around them. These are the stages in which language development, so crying is considered to be a form of language and lets the caregiver know what the infant needs. Around 1 to 2 months of age, the baby starts making cooing noises, babbling around 6 months, and then like I said on the last slide, those gestures come in 7, 8 months, or hopefully by a year we start to see some of that. These different types of cries have to do with pitch, basic cry, anger cry, pain cry. As you move down each one, the high intensity stimulus or noise gets louder and more high pitched as we move from basic angry to pain cry. However, caregivers learn to know why the baby is crying or what it is that they want based on their schedule. You know, if it's been a while since the baby ate or since the baby's been changed, it could be because they're hungry. If they are in pain and colicky or gassy, you know, that'd be maybe more of an anger cry or a pain cry. So each parent or caregiver will get to know, you know, the baby's needs and how the baby is communicating based on the schedule that they keep for the infant. I mentioned social and reflexive smiling. So the reflexive smiling, we see that even in the womb, where it looks like babies have a smile on their face. It's usually just a reflex related to gas sometimes. Social smiling, that interactions happens after the first few months of life, and that's when they'll start responding to external stimuli and facial expressions and the goofy noises and faces that parents make. We'll start to see that in social smiling. Infants experience a wide range of emotions during the first year and second year of life. These are some that are suggested that they see the first 6 months or so: surprise, joy, anger, sadness, fear, disgust. Other emotions that they'll start to experience at the second half of the first year and by the end of the second year would be jealousy, empathy, embarrassment, pride, shame, guilt. As they become more independent and mobile, and you're constantly telling them no, not to get into things, some of that shame and guilt and embarrassment will start to come into play, and they'll start to feel some of these different emotions, which will help teach them how to act and how to respond in different situations. Fear and stranger anxiety occur around the same time in an infant's life. Usually around the age of 7 or 8 months is when we'll start to see this apprehensiveness when it comes to engaging with strangers or people that are not the primary caregiver. This goes on different for each child, but on average till about the age of 2.5 or 3, when they start to open up and be more willing to engage with those that are outside their primary caregiver role. You're probably wondering why the clown on the previous slide or why this demonic looking Easter bunny is on the slide, but it goes hand in hand with this whole fear of strangers and stranger anxiety that infants and toddlers experience. These things are abnormal to them. Seeing Santa Claus or clowns or the Easter bunny or something like that is unfamiliar to them. You know, having a friend come over whom they've never met before is abnormal to them. So it doesn't necessarily matter if it's a person dressed in a costume or just some, you know, friend of yours that is considered a stranger to the infant. They're going to have this same type of reaction to somebody that they are unfamiliar with. We see this separation protest often in daycare centers when the parent tries to leave the child at the daycare center. When the baby cries or the toddler cries, the best thing to do is for the parent to walk away. But as a parent, that can be very difficult to walk away from a crying child. But it makes them more apprehensive and more anxious if you stay and try and calm them and eventually sneak out. They need to learn some type of self-soothing skills, and so learning to calm themselves down on their own can help teach them that. And so that's why we also say not to respond to a crying baby every time the baby cries, because that baby is not going to learn how to self-soothe, and they're going to become dependent and reliant on the primary caregiver to soothe them every time. All right, gender, culture, and temperament. Generally speaking, the temperament, we call it goodness of fit in psychology, will match that of the family that the infant is raised in. So with the goodness of fit, that adjustment should be made so that the baby fits in well with the environment that they're being raised in. You can see different images here. The baby's expressing different emotions. We have maybe some curiosity going on, some excitement, some joy, some confusion, but just a wealth of facial expressions here that give us some kind of insight into how the baby is feeling and how they're reacting and adjusting their temperament to their home. We break temperament also into 3 parts: easy child, difficult child, and slow to warm up child. The easy child is more of a go with the flow, doesn't put up a lot of fuss, transitions are not a problem. The difficult child needs a heads up anytime something is going to change. A schedule is so important and essential with a difficult child because transitioning from one thing to the next can be a nightmare for parents that have a difficult child. This child needs to know what to expect. And so keeping them on a pretty strict schedule helps them to anticipate and to learn, what is going to happen so that they can prepare themselves for it. A difficult child, as they grow up, you can't just walk into the room and be like, okay, kid, it's time to turn off your video games. That child is going to put up a fight. It's going to turn into a temper tantrum or a fit. That's the kind of child that needs to go look at the schedule, maybe when they're in elementary school and see, okay, I have free time between 4 and 4:30. Now would be a good time to play my games. I know at 4:30, I have to go help mom with dinner or something like that. So it helps to keep them on a schedule. The slow to warm up child is a little bit of a mix between this easy child who's just going to go with the flow and this difficult child who needs a heads up and a warning every time something is going to change. That child, slow to warm up child, is going to get there. They just need a little bit of a warning, but they're not going to respond in that same, pull back and fight that a difficult child would. So when we look at personality development, we also look at Erik Erikson's first stage of development, which is coinciding with infancy, of birth to a year old. Trust versus mistrust is Erikson's stage during this psychosocial development process. It is important for infants to learn trust, and they learn trust by having the caregiver respond to their needs. When they cry and somebody comforts them or feeds them or changes them, they learn to trust whomever they're with. That is going to look good on future relationships that they have and that they build with other people. So they will start to have a sense of trust in others around them. However, if they do not learn trust that first year and they are neglected in their house, they will learn a sense of mistrust, and that can later have an effect on their relationships, and they will develop an insecurity and an inability to trust others around them. So Erikson has this kind of versus, they either have it or they don't. But again, all theorists, for the most part, have critical periods of development. And for Erikson, he says, this critical stage of developing trust happens during that first year of life. Self-recognition, what we do here for a test like this is called the Rouge test. And if you go on YouTube and search the Rouge, R-O-U-G-E test, you'll see like a 1.5-minute clip or something on it. Basically, it is when infants start to recognize themselves. So when they look in a mirror, and we put rouge or blush, rouge is kind of an old-fashioned name, but blush on their cheek. When they touch their cheek as they're looking in the mirror, then they have some kind of self-recognition. If they're touching the mirror or not making that connection to themselves, then they're not there yet. Generally, we see this about 1.5 years, 18 months of age or so. This is Erikson's second stage of development, so trust versus mistrust. And then we have autonomy versus shame and doubt. And this is when we want kids to build an independence. We want them to have independent skills. Building this autonomy helps give them confidence and self-esteem to start to relate to others outside of the home as they get into preschool and later elementary school and so forth. We want kids to feel confident and comfortable with what they're doing. So they should be feeding themselves. They can be taking off their clothes. They can, kids that are 2 years of age can learn to pick up their toys. Sometimes it's hand over hand, or, we're not expecting them to clean a whole room, but they can learn some independence and, start looking after themselves and different roles that they can take within the family. So we want to encourage this, and then that will help build them up for Erickson's third stage and so forth. Mary Ainsworth and John Bowlby did a lot of work on attachment theory. Kagan, on the other hand, had some criticisms that were associated with his ideas of attachment. He believes that there's too much emphasis placed on this bond in infancy, and maybe he's right in some aspects. All these theorists have these different ideas, and they work hard and they do the research to try and prove their theory, but we can't say every theory applies to every life situation. And if attachment doesn't happen that first year of life, that's not to say that it's never going to happen. It might present more challenging as the infant or child grows, but that doesn't mean that it's not going to happen. Think about these overseas adoptions that we do. Oftentimes babies are not adopted until 18 months of age before they make it over here to the US. Does that mean they can't attach because they're a year and a half and they missed Erickson's trust versus mistrust window? No. It doesn't mean that. So every child is unique and going to present in different ways based on the set of circumstances that they're in. So we can suggest that these things should happen at a certain amount of time or age, but we can't say, for definite, this is what should be happening at this age. As children get past that first year of life, they'll start more and more of this reciprocal socialization. When infants are around other infants, they often don't interact socially. They do what we call parallel play. So they'll each be playing with a toy independently, but won't interact with each other. As they get closer to the 2-year mark, then we'll start to see some of this reciprocal socialization happening as they start to kind of take on this new interactive role with those that are around them and engage with them. When we talk about primary caregiving, it's not to say that it should always be the mother or babies prefer the mothers to the fathers. They're going to attach strongly to whoever the primary caregiver is. In some cases, it's the mother, and in some cases, it's the fathers. But it doesn't necessarily mean that they have a preference of choosing one over the other. But whoever is the person that is spending the most time around them during that first year and, putting them to bed at night and giving them their baths and feeding them, that is the person that they are going to most strongly attach to. And that attachment typically stays stronger than the attachment they have with the other parent all throughout childhood. But again, there is exceptions to every rule. And, that's not to say every kid is going to demonstrate the same type of attachment. Local, state, and federal governments have put different types of parental leaves into effect to help support families. Maternity leave, obviously, when a woman has a baby, she goes on maternity leave. This in our country, on average, is about 6 weeks. If you have a cesarean, generally it's 3 months because there's a longer healing process. Some companies today have started to offer paternity leaves. So not just the mother gets time off, but also the father does to help bond with the baby and support the mother. There's some type of parental leave. Perhaps the parent leaves the job and chooses to stay home and raise the child We see that a lot with this child rearing leave as well. Family leave, if the child becomes sick or if there is some type of special circumstances, sometimes they can get approval to leave their position at the company for a period of time. So all these types of leaves are put into place to protect, the rights of the mother and father when they are having children and needing to focus their attention outside of their careers. Finding appropriate childcare can be rather challenging today. We usually either have two choices. We have a private home daycare and we have a commercial daycare, such as the Learning Tree or KinderCare or the Montessori schools. And so it's a personal decision, but often, we have to weigh the pros and the cons to each. If you're in a private home, there's probably less kids around. Perhaps that means more attention is being paid to your child. However, maybe there's less regulations, so the quality of food that they eat isn't as, established or watched, monitored as closely as what we would see in a commercial daycare. Although you could argue that, commercial food, such as what we see in school lunches, or would be the same thing in daycares, is not up to standards either. So there's a lot of things to consider. With commercial daycare, there's more security. The doors are locked. People aren't just wandering in and out. With a private daycare, you have neighbors to think about. You have, these people might pass background checks that are watching your child, but whom are their friends and how often are they coming around? So there's less control over things like that. It's a difficult decision to make today, and there's not a right or wrong answer for everybody. Sometimes family can pitch in and help out, but that, doesn't, anybody you leave your child with, there's risk that something is going to happen because, you're the parent. You're going to take care of that child to the best of your ability. That child is going to be your, main focus, and you're going to do everything you can to make sure that that child is safe and protected, hopefully. We can't always guarantee that when we place our children in the hands of others to care for them. It can be great to read reviews on different daycare facilities, whether they're private or commercial. But if by chance you can find out why somebody stopped sending their child there, that's an even better resource to go after. And that can be difficult to figure out. But that will tell you sometimes more than what these reviews will tell you. If it's a private home care, stop by at a, kind of unconventional time to see, what's going on at that house, to try and get a sense of, the whole picture and not just the time that your child would be spending there. Ask to do, visits at the commercial daycare to see the different rooms and how the rooms are operated at different times during the day. So you want to make sure you're doing enough research and deciding, which is going to be the best fit for you, your child, and your family overall. So there's lots of things to consider. And, parenting, there's no rule book, there's no right or wrong way. A lot of it's trial and error, and you just got to figure it out as you go along. Maybe it gets easier, but that's for each to decide on their own what's the easy ages and what's not the easy ages. So that wraps up our infancy, and next time we will talk about early childhood. Take care.